Gene therapy for hair loss. I am Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. There is conflict of interest. We have a company, Live Natural Products Private Limited, that provides anti-aging and gene therapy products for doctors as well as patients. Let's start with the introduction. Recent advances in epigenetics and anti-aging medicine has discovered what I call molecules of interest that influence our cells at a genetic level. Use of this knowledge will help us to provide better and holistic treatments for hair loss. Indications of these treatments: androgenic alopecia or genetic hair loss, telogen effluvium, hair loss in autoimmune conditions. Lastly, hair loss in chemotherapy and radiotherapy, or hair loss post-pregnancy and hair loss post-severe infections or diseases. Why do we call it gene therapy? When a product or a process is used to influence or modify the expression of a gene, then we call it gene therapy. So what is gene expression? It is the process by which information from a gene is used in the synthesis of a functional gene product that enables it to produce end gene products that ultimately affect the phenotype. Regulation of gene expression includes a wide range of mechanisms that are used by cells to increase or decrease the production of a specific gene protein. The following molecules: resveratrol, fisetin, NMN, that is nicotinamide mononucleotide, grapeseed extract, etc., act on genes directly to modify their expression. That is why we call it gene therapy. What are the molecules of interest? Right now, these are resveratrol, NMN, fisetin, grapeseed extract, calcium alpha ketoglutarate or alpha ketoglutarate, and rapamycin. Findings. Now, when resveratrol and fisetin are placed intradermally, they increase TERT, telomerase reverse transcriptase expression in keratinocytes. Secondly, it also increases Ki67 plus cells around the dermal papilla. Both of these stimulate stem cells present in our hair follicle bulge area. The stem cells multiply, resulting in pushing the hair from telogen to the anagen phase. Fisetin, which is present in strawberries famously, is a senolytic that kills senile or senescent cells. Fisetin removes the senile melanocytes from the hair follicle, resulting in improved hair growth and possibly reversal of hair graying. NMN. NMN is a NAD precursor. Hair is the fastest multiplying part of the body which needs the energy. Stem cells need NAD for normal multiplication. So NMN provided intradermally, that is in vicinity of the stem cells, increases stem cell proliferation, resulting in improved hair growth. Similarly, grapeseed extract, when placed intradermally, leads to proliferation of hair follicle stem cells. If you wish, we can give you all the reference studies to these products. Caution: resveratrol and grapeseed extract have been used for improving hair growth and reversing hair aging. However, further studies are required to determine, one, the duration of efficacy of these treatments, and secondly, for how long and in how short a hair these will be efficacious. Right now we are seeing them that they are quite efficacious even in fine vellus hair. The process. Our efforts have been focused on applying the research findings into clinical settings successfully. However, there are some difficulties in replicating the research's positive effects. This depends upon transplanting the molecules, that is NMN, resveratrol, etc., in a suitable medium to the desired target location at the optimum frequency and at the correct dose. So now we go to the steps. First, clean and wet the scalp before using a derma roller. Then use the derma roller. You can also use a derma pen or a derma stamp of 1 millimeter needles to create fine 1 millimeter deep channels in the scalp to facilitate entry of resveratrol and grapeseed extract into the scalp skin. So finally, once the channels are made, apply the custom-made resveratrol grapeseed extract serum to the scalp. The serum has to be applied once a day, possibly at bedtime, whereas the derma roller is used once a week. This is a gene therapy result. The patient was not on minoxidil or finasteride or any supplements. Only derma roller and resveratrol grapeseed extract was used. An interesting thing in this patient was that he got a buzz cut again at 45 days, and as we can see, a lot more hair growth was observed. We will be collecting more patient results and sharing with you in future. Precautions. While most of these molecules are safe, we advise caution in pregnant and lactating females who are advised to avoid these therapies. Changes seen at cellular level. NMN and grapeseed extract induce increased proliferation or multiplication in the stem cells of thinning or miniaturizing hair follicles, and in the hair which are in forced telogen phase in telogen effluvium. Resveratrol is an antioxidant. Resveratrol and fisetin increase TERT levels in the skin and also increase rapidly multiplying Ki67 plus cells around the hair follicle. These stimulate the stem cells in the hair bulge area to start multiplying. Resveratrol and fisetin also protect the niche of stem cells in the bulge area of the hair follicle, thus effectively reversing the hair loss process. In gene therapy, one must understand the importance of epigenome optimization. A healthy epigenome is a prerequisite for healthy hair growth. Epigenome improvement includes a range of measures to address and correct lifestyle anomalies. These include diet, sleep, breathing exercises, cold showers, intermittent fasting. Individual lifestyle issues need to be elicited and corrected. A good way is to encourage the patient to share his or her thoughts on the likely lifestyle causes of their hair loss. This also helps the patient understand that lifestyle changes have an impact on their hair loss. The future. The future consists in us keeping an open mind and researching these products and using them in our clinical application. Delivering select proteins or RNAs made by genes directly into the bloodstream is the future I foresee. There are two methods. One is potent stem cell differentiators. These help stem cells complete their differentiation to the desired tissue type. For example, growth differentiation factor 11. Humans using them have noticed improved hair age reversal and also better hair regrowth. But more results are awaited. Second is injecting RNA or gene material through intravenous or intranasal route. So while above may be even more effective ways to reverse hair loss and skin aging, they require more safety studies which are being conducted. Thank you.